Hello, everyone, and welcome to today's session. It's my great pleasure to welcome all of you to this event, which is a first of its kind for the Ontario Health Central region and the CSS providers, some 110 agencies. My name is Raymond Applebaum, and I'm here as CEO, Peel Senior Link for our agency, and of course, as a member of the CSS Advisory Committee and co-chair of the partnership working group, and we'll provide you with some more information about that shortly. I'm really excited to be here today. We've been planning this for a couple of months now, and we're just delighted to know that there's over 280 people registered for today's event. So welcome, great to have you here. We have a great program for you today, but before we get started, I would like to acknowledge the land that we are on. I would like to begin by acknowledging the Indigenous peoples of all the lands that we're on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the land which we each call home. We do this to reaffirm our commitment and responsibility in improving relationship between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territory for all the Inuit, Métis, and First Nations people that call this nation home. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how we can each, in our own way, move forward in a spirit of reconciliation and collaboration. All sessions today will be recorded, and a copy of the sessions will be available to you through the PeedLoop platform. We welcome you to interact with us, and kindly keep in mind that this is a professional space, and we ask that all questions and comments are presented respectfully. Let us know your name, where you're from, and ask the question that comes up. You can use the question tab at the bottom of your screen for inserting questions following each of the presenters. I am delighted to introduce as a kickoff to the event, Susan DeRick. Susan is Chief Regional Officer, Ontario Health Central and West Regions. And followed immediately will be Matt Anderson. We're delighted to have Matt here today as CEO of Ontario Health. We did provide short bios for the presenters, so I'm just going to move directly into doing a quick introduction, and then we'll move into their presentations. If I could ask for Susan and Matt's presentations to allow them to complete their presentations together, and then we will open questions up to one or both of those individuals. In terms of my role as moderator, I'll be reviewing the questions and answer box as they come in and pose them to the speaker or speakers during the predetermined question period. It is helpful for us to all participate and take good advantage of this opportunity to share knowledge with both the presenters and with each other as participants in today's conference. I'll also ask that when the speakers are speaking, if they could just be mindful that we do have interpreters, as you can see, with us today, which we're delighted and very thankful. And please try to speak a little bit slower and leave a little bit of time at each of your sentences. We are very, very pleased to bring forward Susan DeRick, who, as I mentioned, sponsored this event for us today, and the recognition of the critical role of the community support services in support and service to our communities, and our future role in health system transformation that we'll explore further on in today's conference. Without further ado, I will invite Susan DeRick to please join us.
Thank you, Ray. And good morning, everyone. It's such a pleasure to be here with you today at the first CSS Regional Conference. And on behalf of OH Central Region we are proud to sponsor you for the Partnerships and Pressures Conference. We are also grateful to the members of the CSS Advisory Committee for their efforts in working in collaboration with the Regional Learning Center to plan and facilitate today's event. And it's great to see so many CSS partners and providers here. I was very pleased when Ray just articulated there's more than 280 people registered for this event. It's wonderful, and we really do appreciate you taking time to attend this event. I think it's going to be a really meaningful and thoughtful day as we learn more about transformation and how we can work better together. However, I am going to dive first into a topic which I know is on everyone at the conference's mind. When are we going to learn more about funding for fiscal 2023-24 for the sector? And when will we better understand our allocations and the funding opportunities that will come out for transformational initiatives? Not surprisingly, this is a question throughout the healthcare system post-delivery of the provincial budget a few weeks ago. The provincial budget included an estimated $81 billion for healthcare spending this year, about 40% of the overall expenditure within the province. At this point, we are continuing to work with our ministry partners to understand what it means for all of our healthcare providers and practitioners across the various sectors. We are also actively working with our ministry partners to understand the breakdown of each of the budget allocation lines for the different sectors. And once we have that information, and as soon as we have that information, we'll be sure to share the details with all of our community support organizations. As this work unfolds, we will continue our collective focus in Central Region on offering the right care in the right place with our overall intent and our collective effort to optimize the available funding. And I want to share with you, we really do appreciate that there has been limited funding for the sector over the last number of years, and acknowledge the pressures that all of you have flagged to our teams. I know our team in Central Region is aware of your pressures and concerns, and we will continue to work together on innovative ways to better address the overall system capacity and utilization, and look at what's working well and where there's opportunity to do things differently. I also look forward to your leadership, your advice, and your partnership as we work together to ensure the people in Central Region have access to the critical services they need today and as we go into the future. And we couldn't do any of this work and planning without your support and without the support of the regional advisory table. The table's purpose is to bring together strategic thought leaders to collectively identify and address longstanding issues within the sector. And also it brings forward expertise, advice, and experience to the Health System Recovery and Transformation Table, which is a table I lead of system partners and leaders across Central Region. And we're really focused on in initiating and implementing broad system strategy in alignment with Ontario Health's annual business plan, which Matt is going to speak a little bit about in a few minutes. At the same time, the table has also been highly effective in identifying common and emergent issues and developing potential solutions. It's been effective in supporting and participating in the prioritization and development of regional-wide policies, leading practices to promote sharing, facilitating communication with all of you, and fostering a culture of innovation and learning within the sector and across the system. At the same time, over the past year, the committee has also been focused on a couple of big projects, including today's virtual conference, which is focused on improving overall access and flow in the sector through knowledge transfer, sharing of best practices, and spotlighting innovative partnerships. I know it's going to be a wonderful day. Another critical focus of the table has been a health and wellness strategy for the CSS sector, which is so critical to the stability of the sector, its workforce, and all of you in leadership positions. And we look forward to learning more about that. I'm now going to hand it over to Matthew Anderson, President and CEO of Ontario Health, to talk about the provincial strategy for our health system. And then I'm going to be back to you to talk about something I know is also on your mind, Ontario Health Teams. With that, over to you, Matt.
Great. Thank you very much. Thank you, Susan. Thank you, Ray. So great to be here. Some of you may know I used to work in Pure Region. I had the great pleasure of working with Ray and a great number of you, and it's always great to be back and talking about with all of you folks. And not surprising, as I listen to the incredible work you're already doing that Susan has described, doesn't surprise me at all. You guys, many of you have been at the forefront of providing services to your community, and look to you to carry on that great work. So thank you, and thanks for coming together. For those of you who don't know me, I'm Matt, President and CEO of Ontario Health, and really thrilled to be at this discussion and to talk a little bit about the strategy moving forward. Before I do that, just a quick comment on Ontario Health. Just a reminder, hopefully a reminder for folks. Ontario Health is a Crown corporation. So we are not the government. We don't speak for the government. We are a Crown Corp. I like to tell people that we're kind of like Metrolinx or the LCBO. Of course, we're not as much fun, but we are we're like those groups. And so our job is to work with you, all of you, bring ideas, plans, recommendations, proposals to ministry, so that they, in turn with the government, can develop policy and direction for our healthcare system. We're very thrilled that recently we have the province has released a health plan, a strategic plan for the healthcare system for the next. It's a multi-year plan. It's the first time that we've had a health plan written down in probably more than 10 years. So very excited that this has come forward. I'm hopeful that all of you have had a chance to review it. It's called the Your Health, a Plan for Connected and Convenient Care. And I'm just going to highlight a few things from that plan and then talk about what does it mean for Ontario Health and ultimately for all of us as we go through this fiscal and the fiscal years to come. So the first thing about the plan is that the government has divided it into 3 sections. The first section called Right Care in the Right Place. The second called Faster Access to Care. And the third, Hiring More Healthcare Workers. Now, on this right care in the right place, this is very important to us on a couple of fronts. So first is that it really is describing upstream care before you get to the acute care system. It talks quite a bit about Ontario Health Teams, which Susan's going to comment on in a moment. But it also speaks quite a bit about community care, palliative care, options for care in the community, and also digital and virtual care. Now, what I'm particularly excited about is that it is one of the first times that I've seen in my career where any government has called out the need to focus on care in the community. And the fact that this is the first of the 3 sections in the document is very, very encouraging. Very encouraging as well that the province is looking for, the government is looking for us being Ontario Health and the system, to come up with creative ideas for helping people stay well in the community. I know for all of you, and certainly Ray and others, we've been talking about these concepts for a very, very long time. this is not news to the people who are on this call, how important it is that we invest and focus on care in the community. However, this is one of the first times in my career where this has been called out as something by our government as something that we need to focus on. Per Susan's comments, of course, what we need to understand is what does this look like? How is this being reflected in the budget that has come forward? And it's something that we will look to. But regardless, a very important development for us, and I'm excited that this has come forward in this plan. The second section of the plan, faster access to care, that's a more traditional, what you would expect in a healthcare plan. Important nonetheless, but more traditional. It talks about emergency room wait times. It talks about surgical wait times. It talks about beds and institution-based care, and all critical parts of the system for sure. But is positioned sort of secondarily to the right care in the right place. And then the third section of the plan on hiring more healthcare workers. So again, important that this has been identified as part of the provincial strategy. I would say that part of our collective work, that many of the plans that are highlighted in this section are great, but they are focused on perhaps medium to longer term solutions. For instance, opening more spots for in our colleges, in our universities, to train more healthcare professionals. So that leaves it to us to work together on what are some of the immediate term things we can do. Certainly the internationally trained folks is part of the strategy, but what else can we do when we look at scopes of practice, when we look at team-based care? How can we together work on addressing some of our health human resource pressures, and recognizing as well, and very importantly, that a key part of that is focusing on retaining staff and making sure we've got an environment that people want to work in. So that's essentially the strategy. As I said, it's a great document. I'm hopeful that you all, if you haven't downloaded it yet from the ministry website, please do so, because it does end up setting the course for us within our system and within Ontario Health. So if I switch to what does this mean for Ontario Health? So first, it's great that we've got a strategic plan to lean up against. One of the things that we put front and center at Ontario Health is to look at all of these different strategies and apply an equity and anti-racism lens. And as we know, and all of you know, many of you better than I, we can, without applying an equity and anti-racism lens, we could actually achieve the strategy on paper without actually improving health equity. So some of the things that we are doing at Ontario Health as we look at the strategy, two things in particular. One is that we continue to move forward with the high priorities community strategy. The government is very supportive of these plans, and in particular looking at different population strategies, including a Black health plan, an Indigenous health plan, and access for French language health services plan. So we have community-based plans, population-based plans, and then also looking at further developing an information infrastructure to look more broadly at how we are achieving equity and anti-racism as we implement the strategies that the province has discussed. And just to give you an example, a little story, one that occurred for me early in my career. For all of you, I'm sure it was obvious. For me at this time in my career, was not as obvious, but it was very, very meaningful. So this was many years ago when I was working at the Toronto Central LHIN. And at that time, the provincial strategy was to reduce wait times for certain procedures. And we had made investments and we had made all these changes. And sure enough, we were very pleased to show the chart that showed that the wait time for particular procedures was coming down. I was challenged by some folks in the community to run that same analysis, but by postal code. And I suspect you all know what happened when we ran it by postal code. So this was in the city of Toronto, and the postal codes that are associated to higher affluence, those wait times came down really sharply. The postal codes associated to poverty, not only did they not come down as sharply, in some instances, they actually went up. So underneath, although we showed an overall reduction, when we applied just a rudimentary equity lens on it, we saw that we weren't actually achieving what we were setting out to do. In fact, we were making health equity worse in the way that we were implementing our strategy. I know this is not a surprise to all of you. These are the kinds of things that we need to build through, and happy perhaps if we get to it in the Q&A to talk about some of the strategies. Easier said than done, as you all know, in terms of the information infrastructure, but we do have a few strategies in place that we look to. A couple more things that I wanted to just comment on before I hand it back to Susan to talk about the OHTs. Also, within, as we look to deliver on the plan that the province has set forward, we never want to lose sight of quality of care. When we think about overall quality of care, there's many different measures. Right now, the province, quite rightly, is heavily focused on access. If we think of the different measures of quality, access is one of those measures, very, very heavy focus there. We want to maintain our work, however, on ensuring the other aspects of quality, including safety and experience. And so when we will build upon the work that we've done in a number of our clinical areas, I'm sure many of you are familiar with the work that we've done in cancer care, in renal care, cardiac, stroke, and vascular. We also want to extend that through to mental health and addictions. And one of the key things that we'll be looking for, going back to Susan's point about the analysis of the budget, is we have a number of initiatives proposed to move forward with mental health and addiction services. We'll be looking to see which of those were funded. And as again, I think all of you would appreciate, when we tackle things like cancer care or renal care, largely and historically, we've tackled those things from the acute care system out. When we think about mental health and addictions, we really have to start at the community and work in. And so a very different strategy in terms of how we're going to improve access and quality and safety and patient experience when we think about mental health and addictions. So much to do there as well. A lot of that is going to get built into clinical care guidelines, which is a great spot for me to pause my comments and hand it back to Susan to talk about the OHTs and a little bit further there, including where we're going with clinical care guidelines. So I'm going to pause and hand it over to Susan.
Thanks, Matt. So yeah, just a little bit on OHTs, and I know many of you and your organizations are actively sitting at your local OHT table. There are 54 approved OHTs across the province, 42 across the province of Ontario, which have active CSS partnerships and participation. And those are really some of those early adopters. Some of the cohort 3 and 4 OHTs are still working on actively working on their participants and understanding who is at the table. In Central Region, all 12 of our OHTs have community support services partnerships and people at the table. So it's a really great partnership in Central Region with our community support partners. And when we think of, back in 2019, when this was all announced, and we were all, and Matt has articulated, he was in a hospital at the time, I was in a hospital at the time, trying to sort through how would we work together differently to really transform the system. It was really starting with that vision of providing a full set of continuum of services across a distributed or an attributed population across a geographic region. So really critical that CSS partners were at that table, were part of the planning, and part of the decision making as we thought about how would we actually improve care across all of the services and sectors to really promote population health within our areas. And as we think about where we are today, so a lot of work has happened over the last few years. However, it's variable across the province. And as we've all experienced, a global pandemic can really slow down and or speed up in certain areas. Partnerships, integration of quality care, and partnerships. So we've been in a bit of a holding pattern over the last number of years, which really, I would say, kicked into gear on November 30th, when the minister has announced the path forward for Ontario health teams. And when we think of what the minister announced on November 30th, it's really about building the system in a way that we're going to be able to embed it into our various areas and really fully implementing care delivery models across the continuum. So the minister announced 5 large sort of pillars of work. First and foremost, creating a common structure to progress to full implementation of an OHT and to support an OHT to become a delivery model for the local region. And with this, it was one of the announcements from the minister was really looking at a new not-for-profit corporation across OHTs. And really, when we think about this, this would allow OHTs to accept funding, to actually hire staff, deliver care in a different way. So to really, truly, along with all of the partnership groups within the OHT, to become a delivery model. As well, the minister announced within the strategy a consistent collaboration for decision making. So ensuring that all of the groups and organizations across the sectors, so really sector-based, would be involved in decision making for the local area for the OHT. And we know that the CSS sector has a very important role in supporting implementation and delivery of care, including in the decision-making portion. As well, sustainable operational capacity, so identification of what we're calling an operational support partner. And this is really an organization that would have the capability and ability to provide back office functions. So HR functions, financial, maybe legal functions to the OHT as a whole. So really providing, especially when we think of some of our community support service partners and other partners within the community sector, really having that ability to provide some of those supports to them because we might not have those in place currently within all of our organizations. As well, and on the operational support provider, I think it's really important to note that the provider would be working for the OHT as a whole. So the OHT would be the decision maker with the operational support partner, the provider of the service. So having some type of MOU or agreement on how that relationship would work. As well, consistency in OHT public-led communications. So across the province, again, there's wide variation in how our OHTs are working within their local community. I would say in Central Region, our OHTs are doing an incredible job in working across partnerships and in ensuring that they are continuing to share best practice, communication, navigation pathways across the local regions. But when we think, or their local attributed populations, but when we think of the broader transformation across the province, having consistent communications consistent communication channels, and ongoing standardized communication. That will be really important in reaching out and actually having further information provided to the public we serve and to patients and clients within the areas. And then I think what's really important, what's really exciting for all of us is delivering better care. And so the implementation of clinical pathways, which Matt touched on in his presentation. So really implementing common integrated clinical pathways for OHTs across the province. And we're starting with four clinical pathways. These are clinical pathways that would be able to be implemented in every community across the province, in every OHT. And they include COPD, chronic heart failure, lower limb diabetes strategy, as well as stroke. And so we know we have people in all of our areas which would benefit from consistent, best practice, evidence-based clinical pathway to help support ensuring better health outcomes for the people we all serve. And wrapped around those clinical pathways are patient experience measures and patient outcome measures. So PREMS and PROMs really embedded within those pathways. So we're ensuring that we're getting the outcomes that are standardized and best outcomes for each individual that we serve. As well, we know with these clinical pathways, while we're starting with a number of demonstration projects, and we're very, very fortunate to have a number of them in a central region. So Muskoka area OHT is currently working on a chronic heart failure demonstration project, and our Berrien area OHT and our Central West OHT are just initiating a lower limb clinical pathway. So really great work going on there, and we'll help lead and we'll get learnings from those as we think about how to implement further across the province and across all of the OHTs in Central Region. We also have a leading project in home care modernization. So thinking about how to ensure, and I know this is something that is on all of your minds, how to really improve access, quality, and outcomes for people who require home and community care services, whether it's provided through our partners at HCCSS or through the multiple community support services partners that are currently offering the service in home. How do we improve outcomes and keep people in their home longer and safer, and avoid having to go to hospital and perhaps in crisis be deemed alternate level of care and be in a hospital bed or have to move to another level of care within the system. Not that we will be able to keep everyone at home, but we do know from speaking with all of our populations that many people would, their choice would be to stay in their home as long as possible, as long as they can safely do so. So our Mississauga OHT is working on that pathway and working with CSS partners to ensure that we're really looking at innovative ideas to keep people home and safe longer. So really that is what the minister announced on on November 30th. It is now April and we are still working on further communications and some further details around that work. I would say recently we announced across the province that Ontario Health has set up 2 tables to get feedback and input and expertise from the field in guiding some of that work. One table is focused on governance, and a second table is focused on clinical integration and best practice. And we have a number of people across Central Region who are on those tables, and so want to thank them. We're just getting those up and started, and we'll have a kickoff meeting over the next few weeks. And then when we think of what's next, what are the policy and strategy development decisions that we're working on, really focused in on a few key items, 4 that I'm going to speak about. The first is primary care within OHTs. So really supporting greater primary care involvement within OHTs, including more consistency in how they are involved in OHT decision-making. And I think we believe, and I think you would all agree, it is critical to the success of OHTs that we have our primary care physicians and primary care services, some of which you provide, involved in consistently delivering care. That is the first point of contact for people within our region. So having that embedded, having that really robust primary care involvement and delivery mechanisms within the OHTs will be of critical importance. Secondly, OHT governance, and I know many of you are waiting for further information on the governance model following the minister's announcement on November 30th, and really want to support the OHT incorporation process, and then expectations related to governance and decision-making practices. So not wanting every one of the 54 OHTs across the province to initiate a different process, but coming forward with some standard processes and supports and tools that OHTs can use to go through that incorporation and nonprofit process, and then leaving some variation for what that decision-making will look like at the local tables. Right now, I know many of you are involved in those decision-making tables, so we know we need variation in how the structure will allow your OHTs to continue to function and work as you've orchestrated them. As well on the operational support provider, and I know this is a conversation that we're having at many tables throughout Central Region around the province, really understanding the role of the operational support partner and the functionality between the OHT and the operational support partner in providing that back office functionality while the OHT is making the decisions and the intersection between those two groups. So we are working with our ministry partners, and we'll get some support from our tables on guidance for the selection of an operational support provider, including the operational requirements that each provider will be required to have the capability, capacity, and expertise to provide to all of the OHTs. And finally, the OHT-led communication. So really that consistent approach and supporting greater awareness of the public with your OHT models and OHT models across the province. So lots of work going on right now, but certainly more work to do. And we're really excited to have some conversation, Matt and I, with you today on all of the things that we've talked about, or any other thing, issue that you'd like to talk about, because we just recognize and acknowledge the incredible contributions of the sector and the importance of the sector and the service and delivery mechanisms that you have in ensuring the success of our OHT strategy and transformation as we look to the future. And with that, Ray, I'm going to turn it back to you.
Thanks so much, Susan and Matt. Excellent presentation, really some excellent information and support. Don't see any questions just yet. People will, I hopefully, provide us with some questions in your Q&A box. So just at the bottom, if you clicked on the Q&A box, put your questions in. I'll make sure they get posed to our speakers. Just in terms of moving our discussion forward. I've had the privilege and benefit to be able to meet with Susan and Matt wearing another hat, which is co-chair of the Central West Ontario Health Team, as they know, and we had some really good conversations. And I think what would be helpful for this group as providers, CSS providers today, is thinking about the context that you just framed for us, which is very helpful, which is, you know, the place where we're going to work and play together. Is how do you see us moving from this fiscal 2023-24, which is more a bit of a stabilization and transition year, into 24-25 and moving forward? I think, and I'm thinking about that as independent and autonomous agencies working in partnership with the health system. And I think that would be very helpful to hear some commentary from you, Matt, and or Susan.
Well, why don't, no, I think Matt's talking.
I was just trying to say, why don't you kick that off, Susan?
Great. Thanks, thanks, Matt. And thanks for the question, Ray.
Sure.
I mean, I think it is I think your question is really important in terms of the independent and autonomous working in partnership. Because I think one of the roles, and I think the committee, the CSS Advisory Committee, has been a great leadership tool in bringing the sector together, and in terms of identifying those common issues, but also some really innovative solutions and ideas on how to focus all of the efforts across Central Region in ensuring that we're improving access to care. And it's really critical. Like the CSS sector is provides such varied types of services, and critical in wrapping those services around many of our vulnerable and senior populations. So it is really important that while you work as independent organizations, you know, you've all got boards, you've all got your own fiduciary responsibilities. It's that intersection on where we can find that partnership is where we're really going to, I think, be able to innovate and change and address some of those long-standing challenges that we've had within the system. And I find that like just so exciting. And in Central Region, you are leaders, I believe, in the province in actually pulling together. And I find, you know, the work at the advisory table, very, I think, difficult discussions, very frank discussions, but also, you know, like really innovative in terms of how are we going to address this? Because we know there's a lot of need. There's not enough services currently. So how do we shift, think differently, and manage our work together to really drive change? And I would say, I would also just do a quick shout out, Ray, to Christina Byzant from CHAT and Baldev Muda from the Punjabi Health Services that chair that committee. And for all of you at the conference who know those two, you know they do not shy away from either the tough issues or from the tough conversations with our teams.
Matt, would you like to respond, or I'll move to the next question?
Just for the sake of getting more questions in, I'll just do a 20-second response. And that is that I really like the way, Ray, that you phrased it in terms of the fiscal years. And so in this fiscal year, I like the way you characterize it. And, you know, conceptually, the way that I think about it, just to, from an ease perspective, is that today, each individual agency's accountability agreement is thick and the OHT accountability agreement is thin. And over time, we want to see that start to shift, right? We want to see more and more going into that coordinated body that Susan has described. You know, there will always be, or at least for this foreseeable future, there's elements that still, you know, they won't really fit into the OHT, or we'll get to them a little later on or something like that. But you see that shift over time in terms of where we're trying to drive the accountabilities and more into that collaborative accountability and away from the siloed accountability. So I thought your description was great.
Thanks, Matt. I appreciate it. And for your response. So I have three questions just before we close this session. Right now, around Ontario Health Teams, is the new entity a service delivery organization? I think they're referring to the organization that will help with the back office, or working with partners to deliver CSS related services.
Yeah, so the new entity really is actually a back office service delivery agent. So it's within each OHT, it's most likely going to be a member organization who will have its own service delivery, but would also provide that back office functionality as a support to the overall OHT, as Matt has just described. As the OHT becomes more responsible for service delivery, it would, have the ability to to hold the funding, to do some of that administrative work that the OHT would not have the ability to do. So they would sort of contract. You can almost think of it as contracted services.
That's great. Thanks so much. Given Ontario Health's strong goals related to, sorry, just lost it here. I had it. Given Ontario's strong goals related to equity and anti-racism, how would this translate into delivery within CSS health service providers, especially given the tight fiscal environment that we're operating in?
You want to start, Susan, or would you like me?
Yeah, why don't you start on that one, Matt?
Sure, just maybe a couple of quick comments, and then Susan can bring it more local if she wishes. So a couple of things to think about. First is that we want to better define the challenges. And using the example I gave before, there's a data element to this that really sits more mostly with Ontario Health, although we are working through and would look for the advice, particularly of groups like who are on the call here, on how best can we collect that information and distill that information so that our objectives are more refined, right? So again, as compared to saying we just want more of X or we want to improve access, can we, where we're trying to drive to and quickly, can we say improved access but with these characteristics? And so there's a data element that would translate in. So it's not really new service as much as are we getting to the communities we need to get to. Second is that we are, and I mentioned in my remarks, we are working with the province, and they seem very supportive of what's currently referred to as the high priorities community strategy. And this is where we might want to, or we're trying to pull out when we have special initiatives that we need done. So in addition to sort of how is the global budget, if I can say it that way, how do we make sure through data and reporting that the global budget is targeting the right communities or is directed towards the correct communities? In addition to that, where we need some specialized funding, and that's the high priorities community and other initiatives that we're trying to do. I don't know all the ones that how you refer to them all, Susan, locally, but from in my world, the Urgent Priorities Fund and other funds where we try to do targeted supports for some of those communities.
Just building a little bit on Matt's comments, I also think this year, through the implementation of our Indigenous framework, our Black Health Plan, and our French language services plan, we will see some further refinement of the work we do in the communities. And I think for many of you working through our teams and our equity team, we've got some very specific initiatives that we've identified and we're finding some funding paths for. And more generally, through the CSS Advisory Committee, that group and the group through our health system recovery and transformation table, they've identified transitions in care and access to care throughout Central Region as a key priority, and every table within every sector within Central Region is focused on that. And it's really trying to avoid those emergency department presentations and admissions. And I think as we think about some of our high priority populations and the very different service and supports that we need to put in place, or unique services and supports we need to put in place. We'll be looking at that throughout the fiscal year as we think about how that CSS advisory committee implements that project with all of you in partnership this year.
Okay, I have one last question, and we're going to move on to our next session. But I want to thank you in starting that for your presentation today and your generous time that you've given us. We really appreciate it. And obviously your commitment to the community support services sector and the work we do in partnership with our other colleagues. Given all the details that you provided, what is your recommendation to CSS organizations to continue to drive innovation, scale, and spread during the transition period? So for example, collaboration approach planning, new funding to support, how can we focus our advocacy and partnership efforts?
That's a great question, Ray. I think doing what you're doing and continue to do it, coming together through conferences like this, sharing best practices, sharing innovation, sharing ideas, as well as continuing to support the CSS Advisory Committee in its efforts to bring that all of those new models, new approaches and planning to that broader health system recovery and transformation table, because that is a tool that we're using in Central Region to drive out innovation across the region, as well as continuing to work with myself and my colleague, Dr. Sasha Bacha, on OHT transformation. And happy to speak to all of you at any time, but really, if you hearing and learning about those best practice and those emerging innovations across the province, we're always taking that back, looking at what's working, what can we spread and scale, what are those things that we need to find some innovative funding pathways for, because we just know they're doing the right things and ensuring that the people that we all serve are having improved access and helping to transform not only care delivery, but system operations across the region.
Okay, well, listen, thank you so much, Matt. Do you have any last closing remarks that you'd like to make?
Just a huge thank you. Thanks for inviting, and great to be here. Thanks so much.
Absolutely. Thank you so much. Again, Susan and Matt, we're very thankful for the time you spent with us today and for your insight and support. Thank you.